Number one issue affecting sexuality after cancer treatment is problems with erections. Probably the second issue for men is alterations in the sensation intensity of orgasm. We will often start off with the oral medications, the pills such as Viagra, Cialis, Levitra. If those don't work, we then really are in the arena of something that's more invasive. For some sex therapists or sexologists, the next step is often the penile pump. The problem with the pump is that the man has to put a very tight constriction band at the base of the penis, because that's what essentially you're trapping the blood in the penis. And the constriction band hurts, the penis feels cold, and there can actually be a hinging action where the constriction band is. I am, however, a fan of penile self-injection. It's a tiny, tiny needle. Firstly, it requires generally just a small amount of medication. And the most important thing is it works. So depression also can play a role in sexuality and sexual functioning. Depression should be treated. The question is, should it always be treated by medication? The catch-22 around this is that many of the newer antidepressants have sexual side effects. So on the one hand, you're treating the depression, which is really necessary, but often people don't continue with the treatment because there are those sexual side effects. Exercise and cognitive behavioral therapy can be very effective in treating that kind of depression. So not someone who is severely depressed, but mild to moderate depression can be treated very effectively with a combination of cognitive behavioral therapy and exercise. Good sexual functioning is dependent on good cardiovascular health. There are not a lot of us around. Very often you may find, within an institution or an organization that there's a nurse who has an interest in this and who has been sort of speaking to patients, is the go-to person. I remember many, many years ago, I was working in a large teaching hospital, actually not doing anything directly related to sexuality, but the word kind of got out that I could talk to people about this. So I would get these calls from nurses, in the GI unit, could you come and talk to this person? I see men and women, gay, straight, all ages, all different kinds of cancer. Cancer recently, cancer long ago, it makes no difference. I will see them always with their partners. It's actually an incredibly joyous thing to see people who have gone through really the terror of the diagnosis and the trauma of treatment. When they come to see me, they are very much in the survivorship phase of the illness journey, and they want to be full players in the dance of life. And that for me is a very joyous thing, and I'm very happy to offer them support and counseling and education, validation around what they've gone through,